Conversations with them, but the information that we're sharing today is so important. We want everyone to know, and we promise you that we are talking on a level where everyone can understand. So thank you. Now, gentlemen, since we were here last week, when we sat here last week, we were told that 33,000 Americans had died from the COVID disease. 7 days later, that number has increased by more than 20,000. That really speaks to the seriousness of this disease. And so I want to go straight to you, Dr. Brown. We've heard some very interesting things this week. Interesting, maybe to say the least. We've heard about remedies, we've heard about hunches. So Dr. Brown, in relationship to what we've heard this week, I'm going to ask you to speak to our audience about the difference between science and hunches.
Denise, thank you so much. This question has been raging for the last couple of days on various statements that have been made concerning treatments, how long this virus will last, and other things that I think our audience should be knowledgeable about. I think we should address it. And I want to address several aspects right now. We're going to play a little game. I'm going to call it true or false. All right. The first one is ingesting and injecting or washing with dilute Clorox and other disinfectants will cure or help your COVID-19 infection. Now, I want to be clear with you on this. This is absolutely false. Ingesting, injecting, or washing yourself with dilute Clorox or other disinfectants will not cure and will not help your coronavirus infection. In fact, it will harm you. More than 100 people have called into the hotline for Maryland to ask this question. So I know it's a question that is within our audience. I want us to be clear that the virus is inside your cells. Washing on the outside will have no effect on the virus on the inside of your cell. Please do not do this. Please do not participate in this. Please do not help others do this as well. This is absolutely false. So number two, if I have a COVID infection before, I cannot get it again. This is absolutely false. And when a health organization says that there's no evidence that says patients who have recovered are prevented from having a second infection. So you can absolutely get infected again. And there are many, many examples of patients who were positive, then they became negative for the virus, then they became positive again. Now, this is a ding, 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 something that just became some new information. There are at least, when this started, we call this the novel coronavirus, and it was one virus. Now we found from China that there are 30 strands of COVID-19. So the problem that exists is that now we realize that we may mount a response to one virus, and then you get infected with another strand of this virus. There are at least 30 strands of identified COVID-19. The last true or false, can sunshine, true or false, sunshine will cure my COVID-19. This is absolutely false. Sunshine will not cure your COVID-19. It might make you feel better because it's great to get sunshine. It may increase your mood and give you a more positive feeling, and that is all healthy. But sunlight and sunshine will not cure your COVID-19 infection. And then the last question that's been asked quite a bit in our community has been, can COVID-19 survive the summer? True or false? Can COVID-19 survive the summer? And the answer is, this is absolutely true. The COVID-19 virus will be with us into the fall. It will survive the summer. So I'm glad to play this truth or false with you this afternoon. We want to be clear on the current interest of questions that others ask.
Thank you so much, Dr. Brown. Now, we know that sunshine does give us vitamin D, and that's a good thing, but it is not a cure for the disease. Thank you for that. Dr. CRAREY, one of the reports that we've heard a lot this week is that emergency room visits are down for patients, that even calls nationwide are down 29% to 911. That's nationwide. What's going on?
Well, the issue is what I would call the fear factor. This is something that is prevalent in the community, and everybody's afraid, very afraid. If any of you have ever been to the emergency room, you know exactly what I'm going to talk about right now. You walk in, and there's a large open area where people just sit around and talk or buy a soda or a snack as they wait to go in, but they're seen by a nurse that's a triage nurse. And this nurse determines whether or not it is imperative that you get to the back immediately, or if you can be one of those individuals who will be sitting out there waiting until they have space in the back for you. When people have experienced this, they are afraid to go to the emergency room, understanding that they could be in a situation where there could be COVID patients sitting all around them, and they wouldn't know it. So they're afraid to go in. The problem with this is that because many people have comorbidities, and I mentioned this last week, that is, they have heart disease, they have kidney disease, they may have liver disease or GI problems, They may have a compromised immune system. Those situations make them more susceptible to the virus, but because of their fear of contracting it, they're not taking care of these problems. Let me break it down to you one more level. If you suffer a heart attack, okay, if one of your vessels in your heart gets blocked with a clot, you have 6 hours to get to the emergency room to receive a drug that will bust that clot open and open the blood flowing back to your heart muscle so that it can be saved. The same thing happens if you have a stroke. A vessel in your brain gets blocked by a clot. But if you get to the hospital in 3 hours, that clot can be burst open with a special drug that we have that we can administer to you. After 3 hours, the brain is dead. After 6 hours, the heart muscle is dead. But people are afraid to go because they don't want to be exposed. And in our culture, there's a tendency to kind of wait on illnesses and see if they're going to get better, because a lot of times we haven't been in a situation where, you know, we felt that we could get the treatment that we needed. And oftentimes our parents have kind of kept us back and said, oh, it'll be okay. You know, take 2 aspirin and call me in the morning. However, in this situation, you cannot do that. Whether you have COVID or whether you have a heart problem or whether you are possibly someone who's susceptible to stroke, you cannot do that. You must make sure that you take care of your other illnesses. I'll give you an example. I had a patient call me yesterday, 30-year-old person, calls me in and says, you know, I've been sick for 2 weeks. And I said, really? Have you been seen? No, I have allergy symptoms. My eyes are running and I'm coughing and sneezing. And I said to her, do you have a history of allergies? No. Okay, so why are you thinking that this is the allergy problem? Because that's what it sounds like to me, and I just figured it would get better. Except this morning I woke up, and when I got out of the bed, I could not walk from my bed to the chair without being short of breath, and I had severe pain in my chest. I said, okay, well, it sounds to me like you need to be seen by someone today. So she said, oh, I went to the emergency room, and they checked me, and they said that my oxygen was okay. The blessing was that they took a chest x-ray, which did show that it was cloudy, which indicates that she's got fluid collecting in her lungs already. But they sent her home. They sent her home and said, stay at home, quarantine yourself from your family, and we'll check the results of your COVID test that we just took, which will take a couple of days to come back. My point is, waiting too long for any medical condition. I've never seen in a medical book or any book written anywhere that says, the longer you wait, the better it is. No, you need to be seen as soon as possible. The sooner you're seen, the better your outcomes all the way around.
Thank you. Important information. Dr. CEPHAS, again, thank you for joining us today. So we know that the COVID crisis poses an urgent threat to our physical well-being, but it does to our mental health as well. Now, we've been in this for about 6 weeks. That's a very long time. What are some of the psychological implications that you're seeing with people who are in quarantine or even who are home?
Well, first of all, thank you for inviting me to be on this forum. I'm grateful to have an opportunity to kind of share some of the things that have been occurring in the mental health field. I want to start by saying that different people react to stressors differently, but you have to remember your stressors and the way that you are actually able to manage and how far your stressors will actually go depend on your culture, your upbringing, depends on your financial status, depends on how many people in the family, depends on your support system, friends. It depends on a lot of how you're actually going to react to the level of stress. Depends on what position you are in the family, if you're the husband, the wife, or the child. So because of that fact, we have different aspects that we really need to look at this from. Remembering that the outbreak affects all of us. If you are alive on the planet, whether disabled or whether perfectly healthy, some way this is going to affect you. It has affected the community, both financially, both relationship-wise, individually. Some people are just plain worried about their circumstance. Some people have difficulty with their regular circadian patterns, which are things like their eating changes. So they either overeat to compensate, or they don't eat enough. Their sleep patterns actually will change. Stress is one of the things that will actually manifest in changing of the sleep patterns. For instance, people that don't want to go through a lot of stress, they may actually sleep a lot. So you'll see your teenager, or you'll see a brother or a sister that are actually sleeping more than they normally do. Let's look at the sense of loss of autonomy. Because of the fact that we are so used to managing our lives and going where we want, doing what we want to do, but yet we are actually restricted in that process, loss of autonomy is a big problem also. So we're seeing a lot of these aspects. Let me give you a little story. My wife and I, as we are going through this, we're runners. So we were out doing a 6-mile run, and we were about 4 miles in. And as we were coming down the path where we were running, we saw one of the neighbors. Now, the neighbor is in the neighborhood. He's familiar to us. Do you know that he practically jumped in sticker bushes in order to stay away from us at a 6-foot distance? Something as simple as that. This is your neighbor, somebody that is used to you, that is attempting to stay as far away from you. This is a problem that we have. Think about that in the aspect of family members and how it changes the interaction with children and parents, or parents and siblings. It causes a lot of stress. And when you have a lot of stress, not only does that cause difficulty mentally, but it bleeds over into the physiological. Without getting into a lot of detail, cortisone is secreted, and cortisone causes difficulty changes in your blood pressure and in your immunity. What are we all trying to do right now? We're all trying to stay healthy. So the stress levels become very detrimental on us when we are actually going through this process of having a worldwide pandemic. There is no place that you can go that you can escape. So therefore, all you can do is try to manage either your anxieties, your fears. Think about people that already are vulnerable, those who have mental issues already, for instance, depression and anxiety. We have seen, and the reports are, that the way to handle that, some people are actually using more substances. For instance, alcohol sales are up 30%. This is a significant problem. And I believe later on we'll talk about how that affects even after COVID has kind of disappeared, or we have it under control. You asked the sense of what may actually help in managing. Well, some of these things are same things that are mentioned from the CDC. One of the things that gives us a sense of control back is, cleaning your hands. Some of my whole family's in healthcare, and sometimes we have to undress in the garage. Not pleasant, but it's something that we have to do. What about cleaning your hands? Avoiding people that are sick. This social distancing, it's a process by which we try to avoid others so that we actually lower our anxieties. So there's quite a few things that we'll talk about in the process of managing anxiety and our stressors.
Thank you so much. We have a video I'm going to ask them to queue up of a person who has actually experienced several of the stressors that you're talking about.
Hi. So just real quick, this pandemic has interrupted my life totally. It have brought many losses for me, 6 to be exact, with one being my oldest brother in the state of New York that I could not go to his funeral today, as well as experiencing disappointment after disappointment after disappointment. I had my birthday, March 14th, going to a Broadway play in New York City. It was canceled. Broadway was shut down. I had a cruise, April the 13th, was canceled by the cruise line because of this pandemic. On top of my graduation for May 16th from college that I can't attend. So this pandemic had really interrupted my life, causing me a lot of stress, a lot of sleepless nights, a lot of tears, a lot of anger, a lot of pain that I don't even want to remember.
We have a question from one of our Facebook viewers. The question is, how do you protect yourself if you need to go into the ER, Dr. CRAREY?
The best thing you can do is practice the same things that we've talked about before, and that is trying to avoid and be in close contact with other people that potentially can be carrying this virus. And oftentimes it may be hard, but you have to almost take an approach that everybody has it. And that way you make sure that you protect yourself with a mask, with gloves, with anything that you can do, that you have available, that you can use to protect yourself from being exposed to someone who has this virus. In the emergency room, that's a tough one because when you go in there again, if you're sick, you're going to be taken into the back, but there are possibly sick COVID patients in the back. If you're not as sick, you're going to be left in the lobby. And if you're left in the lobby, there's a potential that COVID patients could be there as well. Nonetheless, sometimes trying to avoid the COVID may be more detrimental to you than taking care of the illness, whatever it is that's troubling, that you have that needs to be cared for appropriately.
Thank you. And this is a follow-up question to that. Is fever one of the first signs that's an indicator that you need to go to the emergency room? That's a question from one of our Facebook viewers.
If you have fever, you definitely, especially if it's persistent, you definitely need to contact your personal care physician. Very important, because other symptoms may be coming along with that at a later time, or they may be present now, but you may not have noticed them so much. But yes, one of the problems with this virus is a persistent elevation of the temperature.
All right, thank you so much. Dr. Brown, there's been a lot of discussion about UV lights. I know we talked about sunlight earlier, but now we're talking about UV lights. Can you talk to us about, does that really kill the virus? Does it kill bacteria? There's a lot of discussion out there. And one of our viewers from last week wanted to follow up with that question.
Sure, I want to talk about UV light in regards to viruses and viral infections. UV lights are effective in bacteria, but that's not what we're dealing with right now. We're dealing with a virus. And there are three flavors of UV light that exists. I want to tell you that UV lamps cannot be safely used to treat COVID-19 infections. I want to repeat, UV lamps cannot be used safely to treat COVID-19 patients. Prolonged exposure to UV light damages your cornea, that's the outside part of your eye, and causes cataracts with prolonged exposure. Certain forms of UV light, UVA, can get all the way through your cornea down to your lens. UVB is a type of UV light that is used for tanning, and that part of the sunlight causes you also to have sunburns. Now, germicidal, or what we use for bacterial infections, germ lamps, that is called UVC, and that's used to disinfect surfaces. But this type of light can also damage your DNA, and it should be not used on people. I want to be clear. This type of light should not be used on people. UV light causes cancer. It causes a very deadly skin cancer called melanoma. And we wear sunblock on ourselves when we are exposed to sunlight to avoid exposure to these types of rays. Please do not use UV lamps to treat COVID-19?
Good information. We just showed a video clip just a minute ago of a woman who had experienced several losses. Showed a video clip just a minute ago of a woman who had experienced several losses. And Dr. CEPHAS, I'm going to address this to you, but I'd like for all of you all to chime in. This woman is someone who, she couldn't go to New York. She had to cancel her Broadway play trip for her birthday. She had to cancel her cruise. She was supposed to graduate in May. That's 3 losses. And often when we think of grief, we think of death. But their grief comes in so many other different forms. But additionally, on yesterday, she attended via Zoom the funeral of her brother in New York. She was not even able to go to New York to say goodbye to her brother. So she has experienced compounded grief. Dr. CEPHAS, would you like to talk to our audience a little bit, please, about what is compounded grief and grief in other forms other than just death?
Right. We are very used to the fact that grief comes from the loss of a family member or someone else, but we very rarely do we look and understand that it also comes from the loss of things like you said, autonomy, like scheduling, such that we would say executive functioning. And that's one of the biggest problems that we have with this difficulty with this virus. Our personal liberties have been given up in order to protect ourselves. That means that she is no longer able to go and to grieve or say goodbye or have closure on the death of a sibling. Compounded grief is just as you said, when there is loss after loss after loss. People that have compounded grief are also very high to have lower immunity, have more difficulty with mental illness, and more likely to have physical illnesses secondary to the level of stress that grief causes. So there are different things that we can do, but can you imagine the loss of a sibling and not being able to say goodbye and how difficult that would be for someone? Think about somebody who doesn't have a support system or someone who doesn't engage in a support system. As it was previously mentioned by Dr. CRAREY, that people avoid going to healthcare facilities because of the stigmatism of it, because of the idea that if they go, they possibly might find something else wrong, that if they go, they may actually get what they're trying to avoid. In this case, with the amount of loss that she has sustained, I would not say that she should sit home and try to manage this on her own. I would say that she engage her support system, whether it's other siblings or whether it's family members or whether it's a mental health professional that can help her negotiate and navigate through this process.
Thank you very much. Now, Cheryl, the lady in the video, we're going to hear from her a little bit later towards the end of the program as well. We have lots of questions coming in. I have a flurry of questions that I want to ask you, but we're here because our audience has some questions as well. And so we're going to go back to some of the other questions that we're getting from our Facebook family. Dr. Brown, would you talk to us? You mentioned this last week a little bit, but do you think folks are really ready to go back to life as normal? Not social distancing. We know that several states opened up yesterday, even though their rates of death were still increasing. What would you say to those listening about social distancing and what happens even when our state opens up?
Denise, I'm glad our audience asked this important question. Well, we're faced with a dilemma. We need to work in order to support our families, to support ourselves. But we also have to avoid a very deadly and traumatic virus that exists in our community. And I brought this point up last week that if there's a dog that bit your mailman yesterday, and the dog is in the yard and he bit the child riding by on their bicycle, and the dog bit other friends that came into the yard, and you decide you're going to walk into the yard, the dog is going to bite you. And the issue that we're faced with is that we have a virus that we don't have a vaccine for, or we have a treatment for. And I want to say this to our young audience. This virus is not something that we can deal with right now. So the best strategy is to stay away from it. And I know that cramps our style, that keeps us from doing some of the things we enjoy. Uncle Milton enjoys fishing. I love fishing, but I just can't go and do those kind of activities right now safely. I have to stay at home and keep myself safe. We have a dog that is biting in the yard. And if you go in the yard, you will get bit. And so we don't want our young people or anyone in our listening audience to have to experience COVID-19.
Denise, I would also add to that is emotionally, the fear drives us to trying to get back to a state of normalcy, us doing the things that we did before. This is the time for you to look and understand and choose a professional that you trust. Listen to the information that he gives and act upon it. This is not the time to act by emotion. This is the time to act by fact. Because as Dr. Brown said, the dog will bite you. And it has bitten young people. It is no longer just a quote unquote disease of the elderly. It is also a disease of a total generation.
Let me chime in right there as well. I don't know if you all were aware that in North Carolina, they had these massive protests, return to work to open up the state. And after the protest, they had a huge spike in the number of cases of COVID right there. So it's very important to recognize that what we're telling you is based on science. It's not just something that we're digging up from somewhere to tell you about. We have to be vigilant.
Thank you. Question from our audience. Dr. CRAREY, I'm going to ask you to answer this one. What ways do you suggest we protect ourselves and coworkers if you are an essential worker, but not in the healthcare industry?
Well, that's a very important question. The first thing is, personally, everybody needs to maintain the things that we've talked about: coughing in your sleeve, washing your hands, wearing your mask, wearing your glove, all those things we've talked about before. But you have to understand that when your coworker leaves the job, you don't know where they go, you don't know who they come in contact with, you don't know who the people that they come in contact with. So there are layers of exposure to you every time you come in contact with a group of individuals, whether you're working with them or whether you're passing them in the store. However, you have to use the protective devices that we've discussed. The masks we've talked about. Granted, they're not going to stop the actual virus from penetrating, but what they do is stop droplets. And we know that this disease is transmitted by droplet. So if you're an essential worker and you're around other essential workers, I would have in my mind, the back of my mind, that everybody is potentially infected. So I would protect myself against each one of those, which is what we're doing in the medical field. When I go into work, everybody wears a mask. Why? Because we don't know what people do when they're at home or who they're in contact with, but when they come back to the job, they're potentially infected, and so are we. So we protect ourselves against each other.
And in this day and age, we find ourselves even having to protect ourselves once persons find that they are positive, and family members have to quarantine even from other family members. In what areas would you say, in terms of preparedness, Dr. CRAREY, that people can start planning now in advance in the event that they would have to unfortunately quarantine from even their own family in the same house?
This is a very critical thing, and it's something that in preparedness that we have not addressed. I don't think I've heard it even addressed publicly, but I want to share it with you today. Because of the fact that this virus is so infective, and if you look at the reporter Cuomo, I believe he had the disease, and some of his family members got the disease as well. Here's the situation with this. you have to prepare for the possibility of this happening before it happens.
Mm-hmm.
So what do you have to do? You've got to find a room in your house that will be your quarantine room. And what you have to do to prepare that, it needs to have its own bathroom as possible, if it's possible. Now, it might mean that some people may have to double up in another part of the house, but in this particular area, that's where your person will be quarantined. Within that room, it should have its own, like I said, its own bathroom, but it should also have its own laundry container. It should have its own trash cans. That person should be served food only with paper products that can be thrown away. The trash and the laundry from that room, if you would have to do the laundry within the 2-week period that they're confined, would have to be handled very carefully. If you're moving it, you should have gloves and a mask on. If you're removing the trash, you just have gloves and mask on to move that trash and it goes straight into the garbage can, not stopping anywhere to put something else in that. And you would have to maintain social distancing completely from that person. You might have to call them right in the house or text them from being in the house rather than being in a face-to-face conversation with them. It's imperative that some of these basic things be put in place, because when it happens, you're way down the road trying to get things together for this. But plan ahead, pick that room, identify the perfect place for it where your family member could be protected. You will be quarantined from them. You will not be with them, but at least they can feel that they have their own space, but that you're connected with them through whatever means you can without being directly in contact with them.
Thank you so much.
Denise, I wanted to,
yes, Dr. Brown, please.
I wanted to add to what Uncle Pat said. That is very great information about how we deal with preparedness in our home. I also want to say about preparedness in our travel, because our lifestyle has, before COVID-19, was to get up, you pray before you go out and you go and get in your car. But now we want to be prepared when we travel. And I want to say this, the best that we have in protecting ourselves right now is a mask. Most of us don't have N95 masks, so just a mask. And if you could put a face shield in front of that mask, that would give you the maximum protection. So some don't have access to getting or forming plastic face shields that can be washed once you come home, wash them in soapy water. But the best protection is a mask and a face shield in front of that mask. That will give you the maximum protection that we can possibly get at this moment. And we should be prepared in our travel to have those protective devices with us. They don't do us any good at home. They don't do us any good in the trunk. They should be with us as we travel.
Thank you. So keeping masks and gloves, any protective paraphernalia that we can should be kept with us at all times. In our offices, in our cars, anywhere we travel, in our homes, we should have them readily available. That's what I think I hear you saying, correct?
Yes, and I wanted to just make sure we get the point that the maximum protection that we can have is a mask. That's, if it's not an N95 mask, a mask with a face shield. Okay.
Mask with a face shield.
Yes.
Yes. And we know they're out there. People are selling them. I mean, people have really become very creative in recent weeks on how to make them. But in talking about social distancing and quarantine, Dr. CEPHAS, from our families, does that not just intensify any mental health issues that a person might already be dealing with anxiety and isolation and depression? How does that even intensify those issues? And what can they do? What can people do to compensate for that?
Well, yes, it will be intensified. One of the things that I would suggest that people would do is we do a paradigm shift. And when you look at the ability for you to protect yourself, that puts a level of stress and anxiety on you that you should have. But also, I want you to do the paradigm shift to think of that I'm doing this to protect others, people that I care about, people that I come in contact. That gives you a sense of control. I can control how I interact with other people. Whereas if I'm just protecting myself, I'm doing something that just encompasses a small area, but I have to wait for a response from others. So if you start looking at this as you're protecting others, then you have a sense of control. The anxiety, the isolation, that's there. This is our life from here on out. We have changed society, or this has changed society in ways that we cannot imagine. We're only touching the surface of this process, where you go out and the very neighbor that you would lean on their car or stand on their doorstep and talk to, now you're afraid to do that. You have to stand back. Some of the things that I would suggest to people that they can do. Number one is, besides the things that we have talked about, using personal protection for the ones you love as well as for yourself, is also considering making sure that your health is as perfect as possible. There are many ways to do this. Getting enough sleep, finding a way to decompress, which may be that since we're all confined, you may have to go to another section of the house. You may have to step outside. You may have to find solace in a book that allows you to kind of remove yourself for a short period of time. Having a colorful plate. When I say having a colorful plate, I really mean that. The more color on your plate, the better nutrition that you get. People sometimes think that a raw diet is just kind of one of those things that, you know, the people in California are doing. But a raw diet actually brings some positive nutrients that will also help. Antioxidants are very important for removing free radicals in your blood that causes difficulty with stress levels as well as health. So in boosting your health by having as colorful a diet, recognizing when your children are in trouble, if you have children, or when you're the elderly. Remember, I wanted to tell you this. The elderly don't always present as the general population, quote unquote. They may actually not be themselves. You may start noticing that there's difficulty in the way that they're processing. They may not necessarily have a fever, but the way they're processing, the way that they're interacting. I recently saw a elderly person, and when I walked in her room, the first thing she did is call me a name before I even got my name out. And her daughter said, "That's not her. She's on the person of interest list for COVID because this is not her general mental status." Play games. It's fair. Play games. Read. Watch a movie. Exercise. I see a lot of people that are now getting out, but regular exercise helps to lower stress levels, helps to lower anxiety. Those are things that we can do that give us a sense of control. The last thing I will say, besides as being a Christian physician, I'm going to say, of course, spending time in God's word is a source of help that takes everything outside of our control. I no longer have to do it. Spending time in God's word means that I have help. Getting others to spend time in God's word with you, discussing things. You know, now's the time that if you're not close to your wife, sitting down and talking helps to
yes, it does.
To put that thing together. There's nothing like having a person that is so interested in you that they go through this phenomenon together with you. So there's a lot of things we can do, but I'll just stop there because I'll just keep going on and my wife will come and tell me stop talking.
Well, thank you so much. There's so much information that we all want to share, and our audience has a few more questions. But before we go to that, one demographic rather, that has really been affected are our high school seniors.
Yes.
You know, remember when you were a senior, how you looked forward to it, how everything in the 2 years leading up to graduation revolved around all the planning that was done. We have 2 videos that I'd like the audience to see right now.
how does it feel to be a senior while in quarantine? And the best way to answer that is it's rough. I mean, we put in all that work, 4 years of high school, you know, to have that graduation. And to hear that we might not have one is really rough. And, you know, you look forward to your senior class trip and your prom and all that stuff. So, I mean, it's hard, it's rough. But, you know, you just stay strong, try your best, and, you know, continue to do your work and just hope that, you know, God has you, and that, you know, all this will be over soon. Yeah, the next question. I mean, for me personally, I mean, it's really hard being in quarantine. I really want to play basketball. AAU season is canceled first month, and that was my month to, you know, get my name out there again after my injury. And to have it taken away from me is really rough, it's really hard. But, you know, I know God's got me and it's for the best for me. And, you know, I just hope that, you know, all the seniors and all the kids going through this, I mean, you know, we just got to stay strong and stay positive. And, yeah, and hope you guys stay safe. And, yeah, I love you guys.
So, how do I feel about all that's been happening? Personally, as a senior, it's really disturbing. The fact that you look forward to graduating with your friends, having your family there. You look forward to that almost your entire life. And then to have this virus just come and wipe out all certainty, everything that's guaranteed, senior banquets, graduations, congratulations. It's very irritating, honestly. So now most seniors, especially me, we're not certain if we're having a graduation, if we got our class trip canceled. It's very annoying, honestly. Also, I keep praying that my freshman year, my first semester of college, is not wiped out. I'd hate to have to do it online, as I know some colleges already canceled their first semesters, and I just really don't want mine to be canceled, because to have that experience wiped out and having to jump in with everybody else like in the winter semester is not right, I feel, especially having to miss the end of your senior year and the beginning of college. You're just missing so many memories, so many experiences that you'll never get back, and it's not like we can rewind. It's just already happened, and it's very upsetting, honestly.
So many of us are being affected. All of us are being affected, but depending on what your life circumstances are, everyone is experiencing it in a different way. And certainly for our young people, our seniors in high school, our juniors in high school, our freshmen in high school even, we really want to make sure that they are getting the help that they need in terms of preparing, because not only have they lost their senior year as they would have expected to experience it, they've also lost possibly their fall, going to college in the fall with their friends. Dr. Brown, I know that you have a child that's in that very same situation. What is that like for him, and how as a father? Let's take off the professional hats for a minute, and just as a dad, Dr. Brown, how are you assisting, and how would you encourage us to assist our young people who are experiencing this?
Young people are dealing with tremendous loss, as well as those who are also in college, having to come home and not being assured that they're going to go back to school in the fall to complete their careers or their college courses. We have to explain, and we have to be there for our young people to tell them that we're living in a new environment, but God will bring us through, and we will be able to accomplish the things and the purpose that He has for us, even though COVID-19 is there. There are young people who are hurting right now because of these losses, And we understand that, and hurt is sometimes not easy to deal with, disappointment. But there'll come a time when we are able to do things that we were meant to do. At the moment right now, we're in a protective phase. We're trying to protect ourselves from getting this virus.
True. And it's not just graduation, you're right. It's friends and college and prom and basketball. It's so many things that everyone's life is being disrupted. Dr. Brown, while I have you, I wanted to follow up on a statement that you made last week. And the statement was, God created the disease, and you continued with, but the disease has been disobedient. Can you unpack that for us?
Yeah, actually, last week I said that God created this coronavirus. And that's quite true, because God created everything. But he didn't create this coronavirus to act like this. This is a disobedient virus that has mutated for evil. God created coronaviruses. This coronavirus was normal in a bat. It was normal in a camel. It was normal in an animal. He didn't create this virus to jump from an animal into a person and become the coronavirus that we know to infect us as we live today. This virus was a known virus that lived in animals peacefully up until now. God created this coronavirus because Colossians 1:16 says, "For by him all things were created, both in the heavens and on earth, visible and invisible, whether thrones or dominions or rulers or authorities. All things have been created through him and for him." So God created this virus, but he didn't create it to act like this. He didn't create it to hurt and to kill. This virus is disobedient. This virus has mutated for evil.
Thank you for that. We serve a living God who wants the best for all of us. However, there are times in life when things happen. Thank you for that. We have a question from our Facebook audience. Can COVID on fresh fruits and vegetables? And if so, should we be taking any additional measures in cleaning our fruits and vegetables, Dr. CRAREY?
Yes, any surface that is out there the droplets can stay upon them. And there's a varying length of time that they can exist on these things. But yes, if a person has droplets or expresses droplets onto fruit, it can stay on the fruit for a period of time. I have not seen a definitive study that has been done to determine how long on the different types of fruit it will stay. But it does suggest, and I highly suggest, that when you get your fruits and vegetables at home, that you wash them carefully. They even have some things now that are fruit and vegetable washes that you can use to clean them thoroughly before you begin eating them.
Yeah, the recommendations from the WHO, we are slowly relaxing the guidelines. But what Uncle Pat said is the correct way to deal with this virus. Until we know for certain that we can be infected from what we touch, we should wash. But the guidelines that came out, it just came out yesterday, that washing everything from where we buy certain things and we bring it to our house, it may not be as needed as we once thought. But the safest way, right? Because we said we want no one in our circle who we know who are listening to the show. We want no one to be infected with this coronavirus. The safest way is to wash everything that you bring into your house.
So wash our hands, wash our clothes, wash our surfaces, wash our fruits and vegetables. Wash, just wash.
Yes.
Everything. Dr. CEPHAS, in the day and age that we're living in, and things are so absolutely different, Do you think, in terms of mental health challenges for people, do you think that we've seen the worst? And if not, how can people prepare, both the patient, client, and the providers?
No, Denise, I don't think we've seen the worst, because the total impact of COVID has not hit us. But just as I feel for the young people, through their rite of passage being removed from them, there are things that we can do. One of the things that we can do is, if you do not have a strong family support or a strong support system, search out for a support system, because you may not need always to go to a professional, but you do need a support system. The other thing I would say is that if you're unsure of that, is a lot of information. The CDC produces information of what type of symptoms to look for if you think that someone in your family is affected in their mental health by COVID. Then you can go and read the signs and symptoms. And the third thing is, if you see someone in trouble, don't hesitate to get them help. This is not a time for us to be shy. It is not a time for us to think of the stigmatism of going to a counselor or going to a psychiatrist or seeking out the primary care physician. This is a time to get help, because a lot of mental health can be back to normal or even better if we catch it early.
Dr. CEPHAS, I wanted to ask you a question. For people who are isolated because of this virus, what types of things could you tell them that would help them?
Well, I would first suggest that those of us who know they are isolated, that we reach out. In helping others, we literally help ourselves. So if you have an elderly person in the church or elderly person in your community, reach out to them. You know, it's nothing to make a phone call or connect them on a conference call. Even sometimes taking the risk to go and visit somebody in person. A lot of us are relationship people, so we like to touch and we like to hug, and it gives us emotional security. You may not be able to do that, but sometimes just being there, even if it's 7 or 8 feet, just being there. So I would suggest that we actually get in contact. Don't wait for them to seek us out. You go seek them out. Those who are isolated, there are things that you like to do, things that you wanted to accomplish. A schedule goes a long way in helping you organize your life so that it just doesn't seem like everything is up in the air. So create a schedule for yourself. And you may have difficulty keeping it, but create a schedule for yourself. And this is a great opportunity for you to learn something that you've always wanted to learn, or do something that well, as long as you're not trying to go scuba diving or, chase cars or something, but it's a great time for us to learn something new.
Gentlemen, thank you so much. We are down to our last 2 minutes. This hour went by so fast. There's so much information out there, but there are 2 questions I want to get to. Very rapid fire, gentlemen. And one question is, how do you wash your mask, Dr. CRAREY? How do you disinfect your mask, and how often should you do it?
You should do it daily. The best thing to do is remove it. As I mentioned on our last topic last week, you remove it by the loops, not by grasping the front of the mask and removing it. Remove it from the loops, put it in the washing machine, and wash it with hot water with either other masks or other clothes that you have that need to be washed. But that's the proper way to handle it. Hot water, and not touching the face side of the mask, but only the loops that hook around your ear.
Thank you. Very quickly, Dr. Brown, this is from one of our Facebook viewers. Please comment on being in buildings that are ventilated and whether or not someone in that room being infected could cause others within the same space to be infected as well.
That's a good question. I think we have to deal with this question. We don't know the answer to being able for a virus to go through the ventilation system into another room and infect someone else. It's possible that it could do that. We have no reports of that happening. Typically in the hospital, you're isolated. When you're placed in those types of rooms, you're isolated, your air is isolated, etc. But in the case of someone being stuck at home with a person who's infected, there's no evidence to support that that it will go through the ducts, through the filters, into another room and infect that person. Although it's possible, we have no examples of that.
Thank you. And our last rapid fire question before I ask you all for your closing comments. Will antibacterial soap work? It works on my hands, she says. Will it also work with my fruits and vegetables?
Yes, it should. Yes, it should. But there are soaps that are specifically designed for washing fruits and vegetables. And those are purposely designed to deal with the potential of bacterial infections and other infections on the fruit and vegetables. So if you can get those, use it. If you can't, you have to use what you have available.
All right. Thank you very much. In closing, what is it, Dr. Brown, that you want our audience to leave with?
We have changing rules about social distancing that we will be facing over the next 2 weeks to a month, whether we're going to reduce them or how we're going to reintegrate into society. I want you to be careful. Young people, please do not go out and infect yourselves by reducing the standards. Let's wait, let's be careful, and let's be watchful.
Thank you very much, Dr. CRAREY.
I had 4 things that I presented last week. I'm going to add one more to it. Stay informed, stay at home, stay vigilant, don't give up, and stay away from sick people. And the 5th one is stay connected to God. We need him now. If we ever need him before, we sure do need him now.
Thank you. Dr. CEPHAS.
I would say that, remember, we're not in this alone. First God, then your family support system. Reach out to others. As you help others, you actually help yourself. Stay connected, as Dr. CRAREY also said, but remember that because we're in this together, it is no shame for us to reveal ourselves to other people if we're having difficulty.
Thank you so much. We saw the video earlier from Cheryl, and we have one more closing video from her.
Every day I get through this pandemic one day at a time. One day at a time, one step at a time, 1 minute at a time. You know, I got to pray more, and I'm praying more. I meditate, and I'm meditating more. You know, I'm journaling and I'm writing every day my feelings to get out the anger and the resentment and the disappointments that has happened in my life. I put one foot in front of the other, not knowing what that day is going to bring. But I believe that the God of my understanding is going to get me where I need to go. This is painful. This is hard. But I know I can make it. I have great people in my life that just keep pushing me every day, that make sure that I get where I got to go. And I believe that God is going to help me through this.
Cheryl is an inspiration to us all. She certainly is an inspiration to me. You know, it's times like this when we find ourselves in some of the most difficult situations we've ever found ourselves in, that we find just how strong we are. We find the strength to get up and keep going. Ladies and gentlemen, as we close out this afternoon, look inside. Where is your strength? Where does it come from? Find it, hold on to it, and then share that strength with someone else. You never know how you can impact someone else's life by just spreading a good word. To our distinguished panel, Dr. Brown, Dr. CRAREY, Dr. CEPHAS, thank you so very much. We have so many things that we wanted to cover that time just would not allow, but we thank you for being on and sharing your expertise with us. Until next time, ladies and gentlemen, I'm Denise CRAREY, your moderator for the afternoon. Stay home, stay healthy, and stay in touch. Good afternoon.